Good day, everyone. I am Angela Dominic Policarpio, a nursing student from Section 11E, and today we're going to perform the rhetoric demonstration for oral medication. So, oral medication, because it is most commonly used, a route of administration for medication for the patient. With the preparation. So first is check the doctor's order to verify the order. Unfortunately, we don't have any doctor's order here, but I am obliged to continue the assessment with or without a order of the doctor. So next is knows the reason why the clients need the medication. So this is for us to know the accuracy being prescribed by the doctor to the patient. So the patient is recorded to have a nutritional deficiency. So ascorbic acid is required for the patient. And check for the drug name, dosage, frequency, route of administration, and expiration date, because certain medication expires a specific time frame. So the drug name is ascorbic acid. Then the dosage will be 500 milligrams, and then the frequency is OID, or once in a day, and then the route of administration is per oral. So the expiration date will be on September 8, 2020. Verifies the client's ability to take the medication orally. So determine whether the client can swallow, is in PO, is nauseated or vomiting, or having a gastric suction, and then or having a diminished or absent of vowel sound. So, as you can see, the client is NPO or nothing by mouth. So, ma'am, kasukaon ba ka?
Dili.
Or gusto ba ka musuka?
Dili.
Okay. So, the client is reported to not having a feeling of a nausea or vomiting. So, as you can see, I'm at the nurse station and I will be going to get the medication for the patient. But first, I am going to perform a hand hygiene. This is to deter the spread of microorganisms. So, arranges and organize medication tray and cups in preparation area, including the medication ticket, if not using AMAR, because organization of the supply saves time and reduces the chances of error. So we have here the glass with water, and then the medicine cup, the medicine tray, and then also the ticket. There's medication for one patient at a time. Obtain the correct drug. Compare name of medication on label with the medication ticket. And exit ads after removing the drug. This ensures accuracy. So I will be going to get the medication out from the cabinet. And then I will be going to compare the medication from the ticket. So, Cipriana Kaong, ascorbic acid 500 milligrams. Then, check or calculate drug dose as necessary. Double check calculation, check expiration date on all medication and return updated medication into the pharmacy. And then, check records for medication count and compare current count with supply available, especially if preparing a controlled substance. Because outdated medication is not safe to administer to the patient. So, I have here the ascorbic acid 500 milligrams with the expiration date on September 8, 2020. Then, places package unit dose, capsules, or tablets directly into the medication cup. Do not remove the medication from the package until at the bedside, because the wrapper will keep the medication clean. If using a stock container, pour the required number into the bottle cup and then Transfer the medication into the disposable cup without touching the tablet. So, break a scored tablet if necessary to obtain the correct dosage, and then use a splitting or cutting device if needed. This is an example of a scored tablet. If the client has difficulty swallowing, check if the medication can be crushed. If it is acceptable, crush the tablet into a fine powder with a pill crusher. Medication and Mar together on the medication cart. So this is to promote organization and reduces chances of error. So I'm going to have my second check. Cipriana kaong ascorbic acid 500 mg. Ascorbic acid 500 mg. Recheck the label on the container before returning the box, the bottle, or the envelope to its place. So because third check further reduces the chances of error. And so I'm going to have my third check. Ascorbic acid 500 mg. Cipriana kaong ascorbic acid 500 mg. Then avoid leaving the medication unattended. This precaution prevents mishandling errors. Next is locks the medication cart before entering the client's room. So, because medication is not to be left open when unattended. Then, I'm now going to check the room number to ensure that the nurse is entering the correct room. So, according to the MAR, the room number of my patient is 201. So, dayon ko na ha. Next is introduce self and verify the client's identity using the agency protocol. Introduce self to enhance the rapport with the client, and then verify the client's identity to ensure that care is being rendered to the correct patient. Mayong adlaw nay, ako dahil student nurse karon si Angela Dominic Policarpio. Unsa nga nimong pangalan nay?
Cipriana taong.
Ang imong birth date nay?
July 22, 48, 1948.
I-check na ko imong resba nay ha. Next is provides client's privacy. This is to protect the client's integrity. So I'm now going to close the door to provide client's privacy. Next is educate the client and client's family member for the medication to be taken, its purpose, the intended effect, the route of administration, and then the possible side effect. So this is to prevent misconception, to gain trust, and reduces the anxiety of the people on the room. So, maayong adlaw sa inyong tanan, otro. Karon day tuod kay gi-prescribe sa imo nay sa doktor ang magtumar ka og ascorbic acid 500 mg kay kini nagapasabot na naa kay nutritional deficiency, so kulang ka og mga nutrition sa imong ginapangaon. So kinahanglan nimo mo tumar og ascorbic acid ingon sa doktor, tapos ginatumar ni nimo siya sa pinaagi sa imong baba, tapos nay tumaron ni nimo siya every after breakfast. Ag mga posible day na side effects ani kay sakit sa ulo, kaning kaihion ka, tapos maka-experience ka og lipong or kasukaon ka. Assist the client into a sitting position, if not possible into a lying position, because this position facilitates swallowing and prevents aspiration. Ma'am, kaya ni mo bakod?
Kaya yun.
Mulingkod ta, ma'am, ha? Then, if not previously assessed, take the required assessment measures such as pulse rate, respiratory rate, and BP or blood pressure. So, because narcotics depress respiratory center. Nay, nakuhaan na ba kag BP, katong RR, o PR?
Hindi na bugtag.
Compares names of medication on labels with medication ticket at the client's bedside. If using the EMR, scan the client's barcode to verify the administration of the medication. Pick up the due medication and compare labels on the barcode of the drug and the EMR. Administer the medication of the correct time. Takes the medication to the client within the guidelines of the agency. Give the client sufficient water or prepared juice to swallow the medication. Fluids is swallowing and also facilitate absorption of the GI tract. Tumar na tanay ha. Kaya ba nimo hawida nay? Kaya ba nimo tulunon na nakuan na tambal? Tapos dili ba ka maglisod pagtulon?
Dili.
If the client is unable to hold the pill cup, use the pill cup to introduce the medication into the client's mouth. Give only one tablet or capsule at a time. Putting the cup into the client's mouth maintains cleanliness of the nurse hands. If an older child or adult has difficulty swallowing, ask the client to place the medication on the back of the tongue before taking the water. Stimulation of the back of the tongue produces swallowing reflex. If the medication has objectionable taste, ask the client to suck a few ice chips beforehand, or give the medication with juice, applesauce, or pudding if there are no contraindications. The cold of the ice chips will desensitize the taste buds. Juice, applesauce, and pudding will mask the taste of the medication. If the client says that the medication you are about to give is different from what the client is receiving, do not give the medication without first checking the original order. Most clients are familiar with the appearance of the medication taken previously. Next is, stays with the client until all medication have been swallowed. The nurse must see the client swallowed the medication before the drug administration can be recorded. Document each medication given to the client because this serves as the basis for the next or for the other healthcare personnel. Records the medication given, dosage, time, any complaints or assessment of the client, and also indicate my signature. So the medication being given today to our client is ascorbic acid, which is to help boost immune system of our client. And then the dosage is 500 milligrams. The time is 8:30 in the morning and also after breakfast. Then complaints, none. Then signature. By doing the aftercare, this is to arrange and then before leaving the client's room. If the medication was refused or omitted, record this fact on the appropriate record. Document the reason when possible and also the nurse action according to agency policy. Next is disposes all supplies appropriately. Last is replenish stock and return the cart to the appropriate place. And discard use disposable supplies. So this maintains organization.